Welcome back to the TMDSAS podcast, where we'll explore the TMDSAS application in greater detail by connecting you, the applicant, with the admissions experts who are ready to help. I'm your host, Enrique Hasso, Coordinator of Research, Advising Services, and Digital Media at the Texas Health Education Service in the TMDSAS office in Austin, Texas. Joining me today is Dr. Jeffrey Rabek, the Associate Dean for Student Affairs and Admissions at the University of Texas Medical Branch School of Medicine in Galveston. Dr. Rabek, thank you very much for joining us.
Well, thank you. I'm glad to be here.
Well, we have several questions that we'd like to ask you. I think there's no better way than to just go ahead and dive in.
All right. Sounds good.
So could you tell us a little bit about your academic background?
Well, I grew up in Ohio, but went to school on the East Coast. So I went to a small liberal arts school, Drew University in Madison, New Jersey, got a BA in zoology. And I started my graduate work and went to Princeton, also in New Jersey, where I earned my PhD in biochemistry and worked on DNA replication in small DNA tumor viruses. I did some postdoctoral work at Oak Ridge National Laboratory in Tennessee, where we looked at regulation of liver cell or hepatocyte differentiation. Ultimately, I came to UTMB as a faculty member in the Department of Biochemistry and Molecular Biology, and so a major portion of my career has been in basic research, most recently looking at the molecular mechanism of aging.
Oh, wow. That's very, very interesting and a very diverse background from a lot of the other deans that we've been talking to. Zoology, I wouldn't have guessed.
Well, a little bit old-timey, but worked out well.
Well, that's great. So what actually drew you to joining Student Affairs and Admissions and taking on this role that you're in now?
Well, I became, fairly soon after I got to UTMB, I became pretty involved in teaching, particularly in the first and second year in the School of Medicine. And so I became increasingly involved in the teaching aspect of School of Medicine. Really led me to an interest in curriculum development. And so I was involved in developing our present curriculum. And I think we'll have a chance to discuss some of the aspects of that a little bit later. And during this process, I decided that really my interest was working more closely with students and certainly with medical education. And as I developed my interest in medical education, I became a course director, ultimately a member of the curriculum committee. And ultimately that led to my service on the admissions committee for a number of years. I worked ultimately as committee chair, at which point I became really interested in particularly student affairs and admissions. Right. About that time, I got the opportunity to be a JAMP alternate and ultimately a JAMP council member. That got me an opportunity to interact with some of my colleagues and counterparts from around Texas, the other Texas medical schools. And I had the opportunity to assume the position of admissions dean, assistant dean for student affairs and admissions. Took that opportunity and sort of changed my career direction. After serving a couple of years as assistant dean, I ultimately got the president assistant as associate dean, and I've enjoyed that position ever since.
Great. And you're currently the chair of the JAM Council, is that correct?
That is correct, which is really exciting. I really am enjoying that.
Well, it sounds like you have some pretty diverse experience with establishing curriculum and curriculum development. Would you mind telling us a little bit about what the curriculum looks like at UTMB?
Well, UTMB was one of the early leaders in active mission learning approach to medical school education. We were very early on interested in PBL, or problem-based learning, and that's kind of become the heart of our curriculum. Much of our curriculum, about half of the time in the first and second years, is in activities other than lecture. And that's primarily in PBL, or problem-based learning that we've talked about. Also a little bit in team-based learning, or TBL. And particularly our PBL sessions emphasize student role in learning. And our Pbl groups are 8 to 9 students and a faculty facilitator. So they're really small groups that allow the students to really get involved in the information and work closely with a faculty facilitator. Our curriculum is sort of a system-based integrated curriculum. We have consecutive modules,
Okay.
So our first 3 modules are what we call the basic science core modules, and after that it's followed by our system-based modules. These are consecutive modules, as I talked about, but concurrent with the basic science modules, we have what we call practice of medicine, which is our clinical component through the first and second years. As I said, we think of it as an integrated curriculum in two ways. We integrate clinical and basic science, and we also try to integrate across disciplines. So, for example, our first course is gross anatomy and radiology, and so that combines the basic science of anatomy with the clinical perspective from looking at the clinical aspects, for example, x-rays of the specific organs or organ systems that we're looking at during the dissection. We also kind of coordinate across disciplines. So if we look at molecules, cells, and tissues, which, by the way, I was the course director for, that's across disciplines. So we look at the same topic from, let's say, biochemical, cell biology, molecular biology point of view, and look at those as rather than separate disciplines as one aspect of looking at a specific organ system. I want to talk about some recent changes in our curriculum.
Yes, please.
We have introduced the NBME custom exams for the exams of our first and second year courses. Also, our first and second year courses are now pass-fail.
Okay.
We've just introduced what we call SCOPE, which is a longitudinal clinical experience where students work in a clinic, follow up the same cohort of patients throughout their scope experience.
Wow.
We also have what we call tracts, and just an example of a couple would be bilingual health, global health, or translational research, where our students have an opportunity to get an emphasis in some non-traditional areas of medicine that don't correspond to the normal residencies. And the students will graduate with a notation that they did emphasis in that area, but it's not a second degree.
But it still gives them exposure.
It gives them a certain exposure either to some interesting clinical things through bilingual health or global health, and also it can be more research-oriented, for example, in the transitional research track.
Well, that's wonderful. I really wasn't aware about those opportunities for students. Jumping off of that point, besides the fact that it's the only medical school in Texas on an island, what makes UTMB unique?
That makes us a little unique,
Right.
That's true. Well, we were the first medical school in Texas, so
That's right.
Our first class was in 1891.
Wow.
So that gives us a pretty long tradition of medical education in Texas. The other thing that does is give us a pretty extensive alumni network across the state and nationally, which allows our graduates to have a strong base of folks to interact with and help them with their career choices. Certainly since the very beginning of the medical school, the UTMB has had an institutional commitment to diversity. We have some couple of unique clinical options on our campus. We have the Texas Department of Criminal Justice Hospital and the Shriners Burn Hospital for children. Our students, for the most part, all will rotate through the Texas Department of Criminal Justice Hospital. Many of our students will take the opportunity to do an elective or other experience in the Shriners Hospital. We also have the Galveston National Laboratory, which is our BSL-4 lab, which is involved in researching bioterrorism threats, also involved in our expertise and interest in emerging tropical diseases such as Ebola and Zika virus, which have certainly been in the news of late, and we've certainly been involved in vaccine development for some of those emerging tropical diseases. As you said, we are the only medical school on an island, at least in Texas. So this sort of gives our students, I think, a sense of community. So most of our students are going to live within walking or bicycling distance of campus.
Okay.
And I think that gives our students a unique ability or opportunity to socialize in a way that might be difficult for campuses located in a larger city. I'm also the president of the Galveston Island Nature Tourism Council.
Wow.
And so we have a number of other opportunities, certainly have a lot of options for getting away from things in a natural setting. We have some unspoiled marshes and bays and wetlands for hiking, for getting away from it all. We have beaches, so maybe we may be the only campus that has a surf club and a sailing club.
I think so.
Of course, we have, so we could do that. It's hard to do in an inland place, so that's pretty unique to being on an island. We have certainly arts. We have a lot of museums, an arts district, 1894 Opera House.
Wow.
I think so. We have some unique options educationally, and also certainly we have the standard dual degrees, MD, PhD, MMS, MPH, and MBA. But because we have the Medical Humanities Institute here at Galveston, it gives us a unique opportunity to offer an MD, PhD in Medical Humanities and also an MD, MA in Medical Humanities. And we talked a little bit about some of our tracks, but specifically the bilingual health tract, Pbl, and we have Spanish-speaking practice of medicine groups. So that gives our students an opportunity to gain both cultural and linguistic skills to work with some of the diverse Texas population.
Would you mind telling us a little bit more about the humanities in medicine?
Right. So we have the Institute for Medical Humanities, and we use them to provide all our professionalism components of our courses and the humanities portions of our our curriculum. Folks in the MD, MA program usually take a break between third and fourth year, and then they'll spend a year doing their research or whatever work in medical humanities. And the medical humanities here is pretty broadly based. We have students that are doing really specific medical humanities. We also have people doing their thesis in arts and how that approaches or has to do with medicine. We have a couple students that have done theater and looking at medical and humanitarian aspects of medicine through theater.
Wow.
So that's a pretty broadly based program. Students have a really wide option of what they can do. Our MD PhD program is a little bit similar, but we have a small number of students who apply through the MD PhD combined program, but ultimately do their degree not in research or clinical medicine, but do it in conjunction with the Institute for Medical Humanities.
Oh, fantastic opportunities there. Coming back to your point, we do have several applicants who have the choice in Texas, knowing that you came from New Jersey and kind of toured around for a little bit around the United States in your research. What actually drew you to UTMB, and how do you think that could help applicants with wanting to come to UTMB? Well,
as you say, I kind of started out in the East Coast and been steadily working west and south as I've gone forward. Of course, I came to UTMB because of the research.
Right.
But I stayed because I really found my niche, I think, in working with students and my interest in medical education. And I think one of the things that's been particularly interesting or attractive to me is particularly through things like our Pbl Groups. So our Pbl Group, our Pbl component of the curriculum, is put together by a course committee. And in all of our course committees contain both PhDs or basic scientists and MDs or clinical folks, and I think that has provided a really interesting opportunity for collaboration both with basic scientists and with clinicians. And I think that carries over to giving our students a unique opportunity to see particularly the basic science topics from 2 points of view, both the clinical point of view and the basic science point of view. I think that also carries over and gives our faculty an opportunity to work together, both the basic scientists and the clinicians. And I think that carries over to our students and the opportunities they have both in research and clinically.
Absolutely. Now that we've kind of sold students on coming to UTMB, can you actually give some advice on what the admissions committee looks at, and maybe if there are any specific points that you'd like to emphasize on the application to help students stand out?
Of course, as everyone would imagine, we're certainly going to look at GPA and MCAT to make sure students are, will be effective and be successful in our curriculum. But of course, we look at some other things because we're so small group, active learning, and that sort of approach to the study of medicine. We look for a couple of skills particularly. We look for students with strong leadership skills, with strong experience working as part of a group, because obviously that's pretty important to be effective as part of a small group in active learning. A number of things that we're going to look real closely for that I guess would sort of be non-academic. We're going to look for students that are highly motivated, and not just particularly for medicine, but also for working with patients. And so we're going to look for an applicant that has been involved to some extent, both in some sort of a clinical or healthcare-related experience. We're also going to be looking for students who have a breadth of experience. So we look pretty closely at those leadership activities that go beyond perhaps what one would see on campus. We'd like to see students that have had leadership or broad experience in their broader community. So we're going to look closely at that. We certainly like to have the students who have a breadth of experience in terms of leadership and leisure activities. So we're interested in well-rounded individuals. For example, maybe you've played an instrument, maybe you were involved in sports. I think that gives our students a specific breadth of experience, which is really helpful in the PBL or small group learning setting.
Yeah, and kind of reflects the fact that medical schools aren't looking for a cookie cutter version of a doctor.
Right, and then in the small groups, that really gives one student might have had a nursing background, one student might have had a background working in say assisted living or something like that, and so when they're discussing a specific case in PBLs, then they can bring a really unique and perhaps a different perspective to that case or that patient.
Excellent. Well, thank you very much for sharing that. Well, for our last question that we have for you, it's our Mythbusters question. So we've been offering everybody that's come on the show the opportunity to kind of pick out one of the myths that they hear students repeating and I'll actually offer the correct advice for it. So would you mind telling us what your favorite myth is that you keep hearing, and would you mind sharing the correct advice to combat that myth?
Well, we've been, I think, receiving increasing numbers of non-traditional applicants, both re-applicants and folks where medicine's a second career. And as I talk to folks like that, I think they a lot of times have some misconceptions of what the strengths of a re-applicant or a second career person is, and I think a lot of times they really don't know how to proceed. So I'd like to talk a little bit about some of the myths I think involved in reapplication or seeking a medical career as a second career.
Wonderful.
And a couple things are my pet peeves here, I guess. And one would be that certainly reapplicants wait too long. So when I talk to folks, I think I like to point out that if you're not accepted during the open admissions period or you don't get an interview, you've got to have a plan B and start putting it in action. So if you're accepted off the wait list, that's wonderful. Congratulations. If you haven't, you're way ahead of the game. Those folks who've waited really haven't started. You've already got a plan in place and are working at it. And probably the worst experience, which happens surprisingly often, is I'll get a call late in April, somebody's reapplying, and they say, well, how can I have a better application? Well, what do you got, a couple weeks or a month?
Right.
Really, there's not anything realistically you're going to do in a few weeks. So basically, you're going to be applying with the same application as you did last time, And if it didn't work the last cycle, honestly, it's probably not going to work this time.
Yeah.
So if you're a reapplicant or a student that didn't get in, you really need to do an honest assessment of your weaknesses. And even more important, that to have a good plan to correct those and put that plan in a timely manner. Mm-hmm. The other thing I think I see with reapplicants and also, second career folks is they really get bogged down on, I'm doomed if I don't have a job in a hospital or a research lab. I think that's a myth. There's plenty of other jobs where you can acquire really important skills that maybe those students coming directly out of a traditional pathway aren't going to have. Mm-hmm. You're going to have some real-life experience that is going to give you a unique maturity. Quite often you're going to have better time management skills, more realistic leadership experiences, and teaching comes to mind as a really good alternate to having a hospital or research job. Reapplicants are a lot of times a year out and changing careers or several years out, and they're going to have some real strengths compared to a traditional path from that experience they've had in teaching. And I always like to point out, if you are applying, and I was the president of my dorm council, but you helped to develop the science curriculum for the primary grades in your school district, who do you think our admissions committee is going to go with?
Right.
So, there's a lot of things that make those non-traditional applicants unique and give them a lot of strengths that they need to explore in their application.
Exactly. Well, thank you very much for addressing that. I know a lot of non-traditional applicants don't typically get the amount of support that our traditional applicants do receive.
Right, and I think that's absolutely true. And I think for all of us as in the admissions, associate deans, assistant deans, we would encourage those students, to give us a call. Mm-hmm. A lot of times I think students are reluctant to call this, and certainly we can provide them with some help that they no longer might have available since they're no longer in school and have those pre-medical advisors that the traditional students have.
Right. Well, thank you very much for sharing that advice. Before we let you go, is there anything else that you'd like to share with applicants for the cycle?
Don't apply late. I think that's the classic.
Yes.
There are no bonus points for being the last person to push the button.
Right.
Students really have an advantage if they apply early. And you don't need to misinterpret that as you have to apply the first day, but you need to apply reasonably early in the cycle, so you have an opportunity to maybe retake the MCAT if necessary, study for the MCAT, and still have an opportunity for us to get a second score in time to really use that in making admissions decisions.
Absolutely. All right. Well, Dr. Rabek, thank you so much for your time and for talking to us today.
You're welcome. I really enjoyed it.
Make sure you subscribe to our podcast on iTunes, Google Play, or wherever you listen to podcasts to stay up to date with us. Follow us on Facebook at facebook.com/TMDSAS and at Twitter at TMDSAS and at TMDSAS Support. On behalf of TMDSAS, we want to wish all our applicants for the 2018 cycle all the best of luck. Thank you very much for listening. We'll talk to you later.